One moment, someone's talking, laughing, going about their day, and the next, their body stiffens, eyes roll back, and they collapse. No warning, no time to prepare. Just silence. Then chaos. Sounds dramatic. That's a seizure, the brain's version of a sudden electrical storm. And trust me, it's way more common than you think. Hey everyone, welcome to Disease Decoded series on DocDecoded, where we untangle medical mysteries without making your brain do gymnastics. In today's episode, we're tackling seizures. What they are, why they happen, and most importantly, how you can help if you ever witness one. Seizures are more common than you might think. About 5 to 10% of people will have at least one seizure in their lifetime. They are most likely to happen in early childhood or later adulthood. Have you ever seen someone have a seizure and felt totally helpless? Or been told to put a spoon in their mouth? Well, don't. We'll explain why. Don't forget to subscribe so you never miss another medical mystery decoded. So grab your curiosity and maybe a notebook and let's decode this together. What is seizure? Seizure comes from the Latin word sacire, meaning to take possession of. It is a short-term event where someone shows signs or symptoms because of abnormal or too much electrical activity in the brain. This sudden activity disrupts normal brain function. Think of it like your brain's wiring getting a power surge. Lights flicker, systems go haywire, and the person experiencing it might not even remember it afterward. Depending on which part of the brain is affected, seizures can look very different. Some can be dramatic convulsions, where the person shakes or jerks, while others may be subtle experiences like confusion, strange sensations, or staring spells that are hard to notice. There are many types of seizures, and not all of them look like someone shaking violently on the floor. Quick question. Did you know a blank stare or sudden unresponsiveness could also be a seizure? Comment below if that surprised you. Types of seizures. There are two main categories. 1. Focal, partial seizures. These start in one area of the brain. Focal seizures are often associated with structural abnormalities of the brain. They can be simple, you stay awake, might twitch a finger or see flashing lights. Complex, you may act confused, smack your lips, or wander aimlessly. Basically, a very strange zombie mode. 2. Generalized seizures. Arise within and rapidly engage networks distributed affecting both sides of the brain. Generalized seizure may result from cellular, biochemical, or structural abnormality that have a more widespread distribution. It include tonic-clonic, grand mal, the classic seizure with convulsions, muscle stiffness, and unconsciousness. Absence seizures, petit mal, mostly seen in kids. The child just stares into space for a few seconds, then continues like nothing happened. Kind of like me during math class in school. Others include myoclonic, atonic, drop attacks, and tonic seizures. We'll get into the more details on each type in the next video. Sometimes focal seizures can also evolve into generalized seizures. The mechanism is called epileptogenesis. Let's know in details. Epileptogenesis means the process by which a normal brain becomes prone to seizures. It usually starts after some brain injury, like head trauma, stroke, or infection. The first seizure may appear months or even years later. The injury triggers slow changes in the brain that lower the seizure threshold, meaning the brain becomes more easily excitable. In some types of epilepsy, like temporal lobe epilepsy, there's loss of specific nerve cells that normally keep brain activity in balance. As a result, remaining neurons reorganize in a way that makes the network overactive. Over time, this local overactivity or hyperexcitability causes further brain changes until spontaneous seizures start appearing. Chemical changes in brain cells, especially involving glutamate, excitatory, and GABA inhibitory systems, also play a role. Inflammation in the brain may worsen this process. It's like the brain playing a glitchy video game, and every seizure type is a different bug. Have you heard of any of these types before? Let me know in the comments. Are seizure and epilepsy same? The words seizure and epilepsy often get mixed up, but they're not exactly the same thing. Think of it like this. A seizure is like one surprise power cut in your brain's electrical system. Epilepsy is when these power cuts keep happening again and again because of a long-term wiring issue. So if someone has just one seizure, it doesn't mean they have epilepsy. Sometimes seizures can happen due to things like fever, low sugar, alcohol, or even sleep deprivation, basically temporary causes that can be fixed. But if a person keeps getting seizures without any obvious reason, doctors call that epilepsy. Epilepsy isn't one single disease. It's more like a family of related conditions, each with its own personality and cause. Doctors call these different types of epilepsy syndromes. To keep it simple, one seizure is not always epilepsy. 2 or more unprovoked seizures equals probably epilepsy. Now, seizures don't just show up for fun. Here are some common causes. Epilepsy. It is a common chronic condition where a person has recurrent seizures. High fever, especially in children, febrile seizures. Head injury or brain tumor. Brain infection. Stroke, low blood sugar. Alcohol withdrawal. Certain medications or drug use, electrolyte imbalance. This list is not limited ones, but the common ones. Sometimes we can't even find a cause. This is called an idiopathic seizure. Yes, idiopathic literally means we don't know why it's happening. Very comforting, right? That's it, can't help. Okay, now comes the most important part. What to do if someone's having a seizure? Do this. Stay calm and stay with the person. Gently guide them to the floor if they're standing. Turn them onto one side to help breathing. The most important. Remove anything nearby that could hurt them. Sharp objects, furniture. Loosen tight clothing around the neck. Time the seizure. Yes, your phone has a stopwatch. Use it. Don't put anything in their mouth. No spoons, keys, wallets. They won't swallow their tongue. Don't try to hold them down or stop their movements. Don't give them water, pills, or food during the seizure. Do not let crowd to gather surrounding the person so that he can get adequate air. Once the seizure ends, stay with them until they're fully alert. They might be confused, embarrassed, or just sleepy, and that's normal. If this was helpful so far, give this video a thumbs up. It tells YouTube, hey, this is life-saving content. When to worry, red flags. Here's when you should worry and call for emergency help. First-time seizure in adult seizure lasting more than 5 minutes. No regaining of consciousness. Multiple seizures. Back-to-back injury during the seizure. Seizure following head injury long back. Pregnant or diabetic person having a seizure. These situations need immediate medical attention. Also, if someone you know has repeated seizures, encourage them to consult a neurologist. They might need medications called anticonvulsants and proper evaluation like an EEG or MRI. Time to bust some common myths. Myth. People swallow their tongue during a seizure. Fact. The tongue might block the airway if lying flat, but you shouldn't try to put anything in the mouth. Myth. Seizures are always dramatic. Fact. Some are silent or subtle, like daydreaming with a blank face. Myth. Seizures mean mental illness. Fact. Nope. It's a neurological issue, not psychiatric. Let's break the stigma together. If someone around you has epilepsy, support them. They deserve understanding, not fear. Comment busted below if you believed any of these myths before. Complications. Injuries during seizures. Falls, burns, fractures, tongue bites, or head injuries can occur if a seizure happens unexpectedly, especially during driving, swimming, or cooking. Status epilepticus. A life-threatening emergency where seizures last more than 5 minutes or occur repeatedly without recovery in between. It can lead to brain damage or death if not treated promptly. Sudden unexpected death in epilepsy. SUDEPI. Rare but serious. Sudden unexplained death in a person with epilepsy, often during sleep. The exact cause isn't clear, but uncontrolled seizures, especially tonic-clonic ones, increase the risk. Aspiration pneumonia. During a seizure, saliva or vomit can enter the lungs, causing infection, pneumonia. Memory and cognitive problems. Repeated seizures can affect attention, learning, and memory over time. Some anti-seizure medications can also contribute to this. Psychological and social issues. Anxiety, depression, stigma, or social isolation are common, especially if seizures are unpredictable. Poor quality of life, restrictions on driving, swimming alone, or certain jobs can affect independence and lifestyle. Medication side effects. Long-term use of anti-epileptic drugs may cause fatigue, weight gain, heart loss, liver issues, or hormonal changes. Always have follow-up with your doctor. Developmental delays. In children, uncontrolled seizures may interfere with brain development and learning. 10. Pregnancy-related complications. Seizures or certain anti-epileptic drugs may affect pregnancy outcomes or fetal development if not managed properly. Have questions or want a part 2 on epilepsy treatment, driving rules, or seizure first aid kits? Drop your thoughts in the comments. If you found this video useful, hit that like button, subscribe to DocDecoded, and share it with someone who needs to know this. It could literally save a life. And hey, if you're someone living with seizures or supporting a loved one, know that you're not alone. We're decoding the stigma, one video at a time. Till next time, stay aware, stay kind, stay decoded.